ambulances hit another crisis level. Firefighters were waiting for hours for ambulance service. Things are getting really, really dangerous out there with this shortage of EMS coverage right now. And you've been working, I guess, to address that in Cochrane.
Yes, Corey. I'm a retired paramedic, times over 30 years. And last August, there was a public meeting held at the Cochrane Legion, organized by another retired paramedic, just to let the citizens of Cochrane know that there's issues with the current ambulance system run by the province. We had about 80 people in attendance. And from that 80 people, we have formed a Cochrane EMS Citizen Action Group. And we have 14 members where we meet, Corey, twice a month. We have an agenda. We develop terms of reference. And what we're trying to do, Corey, is just let the citizens know that there are issues. And we had an open house, or we had a booth at the annual Chamber of Commerce trade show this weekend. We had 268 people sign a petition. Currently, before the trade show, we had about 2,300 names that members of our group have gone door to door. And now we've got roughly about 2,360 signatures. And we're meeting with our MLA, Peter Guthrie, next Tuesday evening to present the petition to him, and he's agreed to take it to the health minister. And basically, we as a action group, Corey, figured that there are three simple ways that we can actually fix the system. Number one is that our emergency crews are doing non-emergency transfers into Calgary, which is taking our current unit into the Calgary system. And once they get in there, Corey, they're waiting in the hospital for 4, 5, 6 hours. Another crew is doing another transfer, and then we're left with no units protecting Cochrane. So when someone calls for a medical emergency, the units could be coming from anywhere in southern Alberta. They could be coming from Banff. They could be coming from Canmore. They could be coming from Didsbury. And to us, it's just not acceptable. So number one, what we've said is that let's farm out the non-emergency transfers to another alternate source, whether that's private or whether the AHS step up and put more transfer units there. We don't really care. We just want to keep our emergency ambulances in Cochrane. Number two is hospital wait times. This is just an issue. You can go into any particular hospital and see 5, 6, 8, 10 ambulances lined up, and they've got their patients in the hallway, where these paramedics are basically looking after a patient until there's a vat available. Number three, Corey, is flexing. Our crew starts at a shift in Calgary, and they're flex anywhere in southern Alberta. They're going to Olds, they're going to Didsbury, and which is, again, keeping our emergency crews away from Cochrane. So we have come up with three simple plans, and that's what our petition is about. These could be fixed very easily. So if they took our particular 3 points and applied them, it would keep our units in Cochrane.
Yeah, and what I appreciate what you're up to is again, you're not coming from an ideology. The bottom line is you just want to get more ambulances available to people when they need them. That's the thing. As you said, whether it's public, whether it's private, it doesn't really matter. The bottom line is there's underservice right now, and it has to change. And you've pointed out three ways that can be improved. I'd like to get back to the broader policy issues in a few minutes, but something else impressed me. You're working on a proactive thing in that you're accepting, though, that there's going to be slow service and response times for a while. So working on preparing people at least to be able to just people themselves, to empower themselves to respond to emergencies and perhaps stabilize people and save their lives until an EMS officer can get there. Can you expand a bit on that?
Yeah, basically, at our booth we had on the weekend, we said, if you know the unit's going to be delayed for whatever length of time, do you have a plan B? And we had information there on first aid courses. We had information there on CPR courses. And we also distributed the amount of AEDs that are in Cochrane. Currently, we have 20 AEDs located through Cochrane. And just to give you an example, Corey, last September, a 70-year-old golfer collapsed at the 9th hole in Cochrane. He went down. There happened to be residents that back onto the golf course. They went out and performed CPR. The AED was retrieved from the lobby of the golf club, and he was revived before EMS arrived because they were delayed. And currently, right now, we're holding two charity golf tournaments, one in Calgary next month, and one in Cochrane next September. And all the proceeds are going toward more AEDs in Cochrane. Since we started our campaign, a local service group, Corey, has agreed to donate $20,000 to purchase more AEDs in Cochrane. So if we get $10,000 or $15,000 from these charity golf tournaments, put it with the 20, we'll have $35,000 that we can purchase and increase the number of AEDs in Cochrane. And we want them registered. So if a particular person is calling and saying that an individual has collapsed, there's no pulse and no heartbeat, the dispatcher will say, hey, do you know you have an AED within a block or 2 blocks or whatever the situation is? And in this particular case, the gentleman, a 70-year-old gentleman, is out currently golfing, but he was clinically dead before an AED was used last September.
Yeah, and just to expand a bit for people who aren't familiar, so an AED is a kind of a portable layperson's defibrillator unit, and I got taught on those in occupational first aid in the past. They're quite user friendly and safe, but not everybody necessarily knows what those are, and we're seeing more and more of them. But the more we can see out there, the better, of course, because you never know where or when you're going to need one.
Oh, exactly, and they're basically foolproof. You turn the thing on; it actually talks you through how to use it. And if the person has a pulse, it will basically say stop and evaluate the patient. So it requires a bit of instructions, but anybody can use them. And there's the maintenance that's required with respect to the pads and the batteries. But basically they're sort of a foolproof thing. The AEDs is what really saves the patient. CPR will keep the blood flowing, but AEDs is what happens when you shock the heart to get the heart back into some type of rhythm.
Yeah, so there were other things you'd mentioned as I kind of talked about. There's first aid courses people could take down in the urban areas, but we're seeing it everywhere too. Keeping naloxone handy, epinephrine, even. I mean, there's items that need immediate intervention with people that lay people could actually apply if they just had a little of the knowledge and resources in order to do it, just assuming that you're going to have a longer time for an EMS arrival.
Well, that's correct. It's sort of a Band-Aid effect until we can resolve the EMS crisis in Cochrane and Alberta. But we're encouraging the residents of Cochrane and area to make sure that they have a current CPR, a current first aid course. They know what an AED is. And in fact, 2 members of our 14-member committee have already purchased personal AEDs. They run roughly about $1,400-1,500, depending on where you buy them from. So they have taken upon themselves to purchase AEDs for their own personal family.
Yeah. So, moving away from that, and like I said, I just like that at least, it's being pragmatic. I mean, there's a bigger issue to be addressed, and it's not saying we can kick the can down the road for EMS response times. It's just saying, hey, as citizens, there's lots of things you can do to protect yourself in the meantime. Even if we fix the EMS response time issue somehow, it'd be good to have that many more resources and people trained on them if they should ever need them. So getting back to that, though, I mean, it's particularly acute with rural services, though. I mean, Cochrane could barely be called rural these days. It seems to be actually mostly anything that's nearby a large center like Calgary. I live in Pritis. Our ambulance gets pulled into the city all the time. This has been new. I mean, since what was it during Ed Stelmach's time, I believe, when they sort of centralized all the EMS services, wasn't it?
Yeah, basically, we ran in Cochrane. The ambulance service started on July 1st, 1983. I actually was a paramedic in Calgary, came out to Cochrane in the early 80s, took the title of fire chief because I was with the fire department. And then in July 1st, 83, we started our own service. And then the province, for whatever means, decided to take over the service in 2009. And ever since then, it's gone downhill. In 2009, before we took the ambulance service over, we had 2 first-line response units. In 2022, with the population of Cochrane close to 35,000 people, triple, we still have 2,000. We still have 2 units. So it really hasn't kept up with the population growth and the amount of calls that we've got. And so if the government would do our 3 simple steps, it's a start on trying to keep our units in Cochrane. And rather having a unit coming, there's been situations where a car has started from Vulcan coming to Cochrane for whatever instant. Luckily, there were cars that cleared from the closest hospital. But can you imagine having a car coming from Vulcan if you've got a heart attack or a stroke or whatever? It's just, it's not acceptable, Corey.
No, and then it's not just the long runs, but it's something you referenced earlier too, whether it was inpatient transfer or other things. But when they get to those larger hospitals, they can often be locked in and doing hallway care. I wrote a column on this last summer, and I drove by and checked out the Rocky View just randomly and pulled in and went out back. And sure enough, there were, I counted 9 ambulances all parked behind there, and presumably all of the attendants were stuck inside at the hospital that should be out and about somewhere, I mean, ready or possibly in the middle of providing services. But then it gets into a kind of a larger, more complicated issue, because then it comes down to the healthcare itself and hospital staff signing off on taking patients, right?
Yeah, exactly. And we've been told that it's, if you go ahead and drop off a patient at a hospital, it's called abandonment. But we're not abandoning them in a jungle somewhere. We're taking them to a first-class hospital in a particular urban setting. And the problem is that they're downloading the availability of for us to look after, or the paramedics to look after the patients we brought in, because they're short-staffed. When we ran the service in Cochrane, if you spent more than 15 minutes at the hospital, you were too long. If you were a paramedic attending, you would give your report to the triage nurse. She would tell you what bed you would need. Your partner would get the ambulance ready, and within 15 minutes, we're gone. But now in 2009, Corey, the paramedics are part of the AHS staff. So I don't know. They think they can download the availability of the patients to the paramedics, which is absolutely wrong. In fact, I think it's criminal. That they're holding hostage the paramedics at a hospital where they should be out in their area. And for us, it should be back in Cochrane.
Well, yeah, I mean, it's a waste of specially trained skill sets. I mean, there's specially trained people in hospital for caring for patients once they come in. An EMS attendant, a paramedic, I mean, they've got the training and the ability to be out and about. That's the point. That's the purpose. They should be in the field and either, taking part in a transfer or stabilizing something out there. And we're just completely misappropriating a resource when we're using them as care personnel in hospital hallways.
Well, that's right. And they're using the paramedic staff as, you want to say, in quotations, babysitting. Now, if you walk into the hospital, there's a clock there saying your particular time to get looked at could be 2 or 3 or 4 hours. But the only difference is that we're bringing somebody in by ambulance. If it's critical, they probably will get a bed. If it's not critical, they'll say, go in the hallway and wait until your turn comes up. Well, why can't we put that particular patient in the waiting room as if he walked in? But no, the system won't allow us to do that, Corey.
Yeah, so there's trouble on a lot of fronts. I've been screaming this one from the rooftops for a while. As we know, we both know Don Sharp, and he's a great guy, and he's brought my attention to it. I went to meetings down in Okotoks that he was helping host, and it just seems once in a while we'll have a tragedy, and this will hit the news, and everybody gets upset, and then they all forget about it. But this problem just isn't going away. But at least you're making a twofold approach. One with at least, well, let's see how we as citizens can get up and help each other and help mitigate the damage. But at the same time, we've got to change this system altogether because it's just not working.
It's got to start at the top. And looking in Airdrie, was it last month they transported 2 patients by fire truck to their urgent care in Airdrie because there was no ambulances available. And the city of Calgary, as mentioned in the Herald last week, I think a crew stayed with the patient for 3 hours waiting for an ambulance. Well, that takes that particular fire crew out of service. It's not fair. It's not fair at all.
No, and again, it's a different train. I mean, the fire crews are trained to respond to medical emergencies, but they're also trained to put out fires. I mean, if there'd have been a large fire emergency, that they could be delayed. It goes all the way down the line.
It does. It's a system failure. But we got to start somewhere. So our 14 volunteer committee is very committed. Like I say, we had part of our crew went out and collected almost 2,500 signatures based on our 3-point plan. That's going to be meeting with our MLA next Tuesday, and he has promised to take that to the minister. And those 2,500 signatures, that could be 5 or 10 or 8 or 12% of the voting public for that particular MLA. That's got to make a difference, Corey.
Absolutely. Well, I really appreciate you coming on to talk to us, and I appreciate the work you're doing. I mean, all we can do is keep trying and keep hammering on it and reminding them, and hopefully eventually we'll get a positive change. Where can people find more information on what you're doing out in Cochrane and, perhaps helping out or taking part?
Yeah, if we have a Facebook page, if they go to Cochrane EMS Citizen Action Group, you'll pick up our Facebook page. We're trying to keep the residents of Cochrane updated of success stories plus failures, and to let them know what's happening in the community of Cochrane. There are other community groups around. There's Airdrie, there's Okotoks, there's Banff, there's Canmore. And they can go to those particular websites as well, or Facebook pages to see what's happening in their community.